Hi, everyone. I'm Donna Anderson, author of lovefraud.com and host of the True Love Fraud Stories podcast. Today, I'm speaking with Dr. Liane Leedom, a psychiatrist, professor of counseling and psychology at the University of Bridgeport, and a longtime love fraud contributor. We're discussing our most recent podcasts, the story of Renee, a widow who was targeted by a con man. This man married her, then lied to get Renee arrested and demanded money from her in the divorce. Then, 2 years after their divorce, he filed a civil lawsuit against her, claiming harassment. The suit dragged on for 4 years until he finally lost. Now, Renee is doing better, but still isn't quite over the experience. Here's my conversation with Dr. Leedom. I've spoken to plenty of mature individuals, people in their 40s, 50s, and 60s, who have fallen into romantic relationships with sociopaths and feel like they should have known better. So, is there anything that makes mature individuals more or less susceptible to sociopaths?
Well, on the one hand, maturity and life experiences might cause someone to think they were less susceptible. But then on the other hand, adverse experiences make people more susceptible. And some of the individuals who become involved with sociopaths are actually reuniting with lovers they had or boyfriends or girlfriends that they had when they were younger, and they didn't realize, or didn't realize that that person was disordered, and they're reuniting with them. So I think any number of factors can make someone more or less susceptible. The point is that everyone is susceptible. In fact, Robert Hare says that even he's susceptible. So I think everybody in the psychopathy research community has been duped at one point or another. So I don't know. Victims, survivors blame themselves, and that blame isn't really justified usually.
So, how about people who perhaps define someone who's an empath as someone who has a big heart and feels like they need to respond when other people are in distress? So that type of person. I mean, how does a sociopath take advantage of that?
Right. Well, so that would be both through conning and non-conning real issues. And so a person's tendency to want to care for others would make them susceptible to others who want to be cared for. I mean, that's how I define this group of people, is designed by evolution to be parasitic and predatory. And parasite gets their sustenance from the host. So yes, an empath would be an ideal host for one of these people.
Okay, so one of the most shocking things about this particular story with Renee is how her husband made up a story to get her arrested. And then, even though Renee was calm and cooperating, the cops believed the story that the husband told, and she ended up spending 3 days in jail. So I know you've spoken to other people who've been arrested. So how does this happen, and what impact does it have on the survivor?
This is horrific. Because we all believe that in America that we live in a just society, the best democracy and all of that. And so when this happens, almost as much as the disordered individual themselves, this can affect the person's faith in the whole system. And if there is anyone listening to this that has been arrested and charged. And, wouldn't surprise me if people have been falsely convicted because of the way I know our system works. I want to tell you that I've seen this a lot, and it does happen. And so I can make a hypothesis or a conjecture, speculate about why it happens. And unfortunately, I think some of our police officers are themselves sociopaths or psychopathic. And in the very least, they're very power motivated. I mean, who would, most people that go into police work are power motivated. That's why they go into that. And power motivated individuals instinctively cling to and associate with other power motivated individuals. So they would be very much inclined to align with a psychopathic individual who was not yet outed as that. Of course, if the person was outed as an offender and a known bad person, then that wouldn't work. But if they're portrayed as a high status, powerful person, the police would naturally align with them and believe their stories.
But then there are also situations where the survivor is not cool, calm, and collected, and may be making themselves more of a target because they're emotional and crying and or yelling and screaming. So I mean, how does that happen, and what can people do to kind of avert that situation?
Right. Well, so this is a word of warning to anyone who's in a situation where they're trying to get out of a relationship or they're trying to protect themselves, to realize the very real threat that the judicial system could be used against them and weaponized against them. And, Donna, remember we had the colleague who's now passed who spent her career talking about how the judicial system gets weaponized against people. And so if you're in that situation, you have to get help for yourself and emotion regulation skills and be very careful to at least conduct yourself in a way that's not going to make your situation worse. And to be aware of the potential that you could be arrested and to avoid situations where that might occur. And to be also, armed with recording what's happening to you, so in case you might need to use it later on.
So, talking about sociopaths in general, you've told me that sociopaths engage in gaslighting. So, can you explain what that is and how it affects survivors?
So, gaslighting is attempting to alter a person's view of reality, their worldview. And also a sort of a subcategory of that is trying to get a person to believe that they cannot see reality in a correct way, and that they might perhaps be losing contact with reality due to some sort of mental illness. And so part of the way sociopaths operate is they have a distorted worldview. So just their normal way of functioning is to be out of reality. And so gaslighting occurs just through them transmitting their worldview to the victim. And then it also occurs in a campaign to make the victim think that they can't trust what they see, they can't trust what they hear and feel, that they can only trust what they're told by the sociopath themselves. And so this is also behavior is also prevalent in cults, right? You don't believe anything other than what we tell you, that you can't trust your own observations.
So, what would you say are the symptoms of psychological abuse in adults, who have been in this situation, dealing with a sociopathic partner?
Oh, the symptoms that occur after the abuse.
Yes.
So extreme emotion dysregulation, proneness to fear, especially proneness to anxiety, proneness to sadness and grief, difficulty sleeping, lack of trust, and also adopting the worldview of the sociopath that usually involves other people not being trustworthy, institutions not being trustworthy, which we've talked. There are certain institutions that are truly not trustworthy. And so a person has to be able to be in touch with their own senses and their own information processing to be able to determine what about a situation is trustworthy information and what isn't. And when you're overwhelmed emotionally due to abuse, it's difficult to do that. So other symptoms would be an exaggerated startle reflex, waking up in the night, having nightmares, having recurrent memories of abusive experiences. So the whole gamut of PTSD symptoms. And also, if people are wondering, well, how severe is my trauma? One measure of severity is that the whole day goes by and you have a hard time remembering what you did during the day and you wonder where all the time went. That's a sign of what we call dissociation, where you're so into yourself or preoccupied that you're not in contact with what's happening here and now.
So, is there anything about mature individuals getting involved with a sociopath that makes the experience particularly difficult?
Yes, I think practical considerations make it the hardest. So particularly women, and maybe this starts at 30 and not 40, but I just got done writing a human development textbook. And although I gave birth at 41, the age of sterility in women is said to be 40 to 41. And so as women are getting close to that time, they are feeling pressure to find a partner because they want to have a child. And that makes them susceptible to this. Also, so on the practical side, it's that. And then for women that already have children, or maybe men who are single fathers, you're also wanting a stable family life. And I know for me, one of the things that made me susceptible at 40 was the fact that I didn't want to do what I thought was wasting my time dating, because I had my career and I had my kids to take care of, and I didn't want to invest the time into having a partner, but I wanted a partner. So it's those kinds of shortcuts that can leave people vulnerable. And then practical considerations, the older you get. So if you have an expectation that you're going to retire now, so I think probably most people now, the retirement age is 68, not 65, but you're going to retire then, in your 40, you have much less years to work before retirement, supposedly, than you had when you were 20. And financial losses and living paycheck to paycheck is harder for people who are older and potentially facing the end of their work life. And they're wondering how they're going to support themselves financially. That's huge. And then the other practical consideration is physical health. Mm-hmm. As people get older, they're more prone to all kinds of physical problems that are also worsened by stress. And so the combination of all of those worries make victimization of middle and older adults way more devastating, I think, than younger people. Younger people have more reserve in terms of their time and their health.
So, by the same token, then, is recovery from sociopathic betrayal more difficult for mature individuals than younger people?
So age alone is not a factor, but age associated with economic problems, financial problems, health problems, and psychological problems of clinical severity, PTSD, and depression. That's what makes it harder to recover. It's not just age, it's age and together with those factors that make recovery more difficult.
So far, we've been talking about people who encounter a sociopath when they're already mature. So there are also people, however, who essentially get married or form a partnership with an individual who turns out to be disordered when they are young. And then often they feel like they have to stay in the relationship until the kids are out of the house. So how is their experience similar to or different from people who meet a sociopath when they're already mature?
So the similarities are the following: the financial devastation is difficult to endure. And perhaps it's more difficult for the person with the long-term relationship because they're grappling with the lifelong decisions that they made versus the person who maybe was financially devastated, but it was like one decision that was like a couple years out of their life. So it's hard to say. I mean, when you're financially devastated at 45 or 50, you're just as financially devastated. And so, it's hard to say which is worse, if it's a long-term or a short-term. I guess what the other thing that makes the long-term more difficult is that often your financial devastation is coming from legal fees. Trying to get what's just really yours from the relationship. And it's very difficult to win in court against one of these people. So there's the financial end, and I'd say that's the biggest for everyone. That's the biggest, most difficult aspect of it. And then there is the emotional part. So often people who were newly victimized at that age, maybe they have other relationships that they've been in that have been healthy, and maybe they have a career that was okay and are good, and they have maybe children that are okay. And so this sort of kind of period of victimization that just occurred right around midlife is something that they can move beyond, and then they can go back to what they were before. But the person that is leaving a relationship often had children, so they're financially devastated, and they had children with that person. And in a high number of cases, those children, all of the children of the family, are affected by the disorder in some way. So if people are listening to me and they have one unaffected child or one less affected child that's somewhat able to be okay and they're able to have a relationship, you did good. Because many, many people have multiple children and they're all affected. So, and then let's go to the next thing. So that's the social part of it. Then let's go to the next thing, health. The stress of living with one of these people through one's life is enormous and takes its effect on psychological and physical health. So I have seen, sadly, many, many people at, between 40 and 60, maybe older, who lost everything financially. Their health is affected. They have maybe autoimmune problems. They've had cancer. They've had heart disease. They've had other, illnesses that are known to be related to stress. And they have no relationship with their children, or their children are psychopathic and predatory and parasitic. And so they find themselves older and alone. And we really need, one of my goals long term is to see, you know, we need to do something for this group of people. Now, it would not be nice to have some sort of, you know, fund or something to help them, because it's often people who had good careers and who contributed, and then they find themselves at this age devastated by what's essentially a crime that's not a crime. You know, the things that psychopathic spouses do or life partners do to their co-parent and children ought to be illegal, and maybe sometimes they are, but the laws are not enforced. So these are crime victims who lose everything and, you know, face a very difficult last years of their life.
All right. So we mentioned briefly, but you've developed a webinar for Love Fraud on skills for recovery from abuse. So why don't we describe a little bit exactly what the skills are, or what people are learning through the skills training?
So the first thing is all of the skills are based on a person getting in touch with the information that their brain or their mind is collecting through what they hear, what they see, what they feel, you know, and you could add taste and smell there. And we call that mindfulness. It's kind of a, you know, cliche word now, but it's about being in touch with the reality of what's present both outside a person and inside a person, in a way that the person is able to acknowledge the thoughts and emotions they have and realize that those thoughts and emotions may be affecting their interpretation of what is coming in through their senses. So the first set of skills is about that. It's about practicing being aware, really aware. We say that in the when we lead the mindfulness practice, being aware, really aware of what's going on outside you and inside you. So that mindfulness piece is the cornerstone of all the skills, because if you don't have that, you cannot effectively deal with reality. As part of mindfulness, we want to know what our goals are. So mindfulness of goals is also part of skills training, and that enables a person to figure out what skills they want to use in any given situation if they know what their goals are. And sometimes people aren't really sure what their goals are. So that's mindfulness. And so the next set of skills is distress tolerance, which is getting in touch with your body. So we call it, you know, bodily awareness skills. And that's about recognizing, again, through mindfulness, when your emotion is high and when you need to take steps to lower the level of emotion that you're experiencing. And those skills also tell you what to do to lower the level of emotion you're experiencing. And then the next set of skills are emotion regulation skills that involve strategies for increasing the experience of positive emotions like joy, love, and happiness, and decreasing the experience of anger, sadness, shame, guilt, other sort of negative, unpleasant emotions. And then the last set of skills are interpersonal skills that, given if a person knows what their goals are in a situation, they can mindfully enact interpersonal skills to make it more likely that they're going to achieve those goals. So to summarize then, we have mindfulness skills, we have distress tolerance skills, emotion regulation skills, and interpersonal effectiveness skills.
So what is the difference between therapy and skills training?
Oh, you know, it's so interesting that you asked this, Donna, because I was today working on a project for my students. And so I happened to look at the skills training program by the creator of skills training online. And she now makes a course very similar to the one that Love Fraud offers. Of course, she's the creator of it. And her website says this is not therapy, this is psychoeducation. And the website further explains that that's why insurance, they do not accept insurance to pay for it. So this can be, the skills training can be part of therapy, but it is the educational component of a therapy that includes interactions with a therapist and a therapeutic relationship. So what makes what we do in that webinar education is that we're presenting you the skills, or we're presenting people the skills that they can then work on with each other and with their therapists. And we're not entering into a therapeutic relationship with them. We're educating them. And I want to say that course through what's called PsychWire for people wanting the skills training is several $1,000s. So I think Love Fraud has done an excellent job bringing these skills to people in a way that, even though the overhead makes it so we have to charge for them, that it's certainly skills training designed for recovery from these kind of relationships. So that's the other thing you're getting when you get the skills training through Love Fraud, that you wouldn't get it if you took it through the creator of the skills training. You're getting what I think is a modification of the skills for people that have been through this specific experience. So you're getting a lot for a fraction of the cost of what's available in the community, and certainly also what's available online. And the creator of these skills is an outstanding clinician and an outstanding scientist, and would not have put these skills in a psychoeducational format online unless she believed that learning them this way was effective. And I believe too, that's why I did it, because I think that there is enough evidence that learning them this way is effective, that I would suggest that people learn the skills.
Well, if a mature individual in either situation, if it was a long-term relationship or someone that they met later in life, so when this person escapes the sociopath, what do you think are the first things that you would recommend they do for their own recovery?
Well, so I like to consider Maslow's hierarchy of needs, right? I mean, that might be a good place to start. So, of course, we can't get anywhere without stable housing, food on the table, and just basic sustenance. So that financial piece, the finances have to be enough to provide that, to get beyond, potentially homelessness. So securing practical survival needs is number one. I have to say that's number one. And then number two is setting goals and asking yourself, what do you really want to get out of the rest of your life? And then applying yourself to healing enough to achieve those goals.
Okay. All right. Well, thank you very much, Dr. Leedom. This is great. And I really appreciate your insight, and I'm sure many people find it helpful.
Yes. And this woman that you interviewed is an admirable person.
Absolutely. Yes. She's turned her pain around into helping others, which in a way helps yourself.
Right. And actually, that's one of the skills we teach too.
Okay, great. All right. Thank you very much.
You're welcome.
I'm Donna Anderson, and this is True Love Fraud Stories. I hope you enjoyed this interview with Dr. Liane Leedom. For Dr. Leedom's contact information and access to her research, please visit the page about this interview on podcasts.lovefraud.com. You'll also find information about her skills training for recovery from narcissistic abuse, gaslighting, and toxic stress on education.lovefraud.com. lovefraud.com. True Love Fraud Stories is produced by lovefraud.com. Engineering is by Terry Kelly. To learn how to recognize and recover from everyday sociopaths, visit lovefraud.com. You'll find articles, books, and webinars. You can also book an appointment with me, Donna Anderson, for advice about your personal experience with a disordered individual. Book your session today at lovefraud.com/talk to Donna.